Hi, Amanda. Sorry about this. I think someone was trying to use the link. Can you please make us co-host?
Okay.
Thank you.
Hello, everyone. Good afternoon. Good afternoon, everyone. So we'll wait for 5 more minutes for more people to join in before we kickstart the webinar. Thank you very much for your patience. Uh-huh. Okay. Hello, everyone. Good afternoon. Hope our day went well. Hope you had a wonderful work day. We'll be starting the webinar now. Yeah. So, good afternoon, everyone. Good afternoon once again. Um. So today we'll be talking about assessing cancer care, and our topics of discussion would be treatment options, support system, and pathways to care. I am Shalom Johnson, and I'll be your moderator for today. So, we're doing some housekeeping rules. So, welcome to today's webinar. Before we begin, please let us take note of the following. Please keep your mic muted during the session, and if you have any questions, please make use of the chat box, and we'll address them during the Q&A segment. Okay, so we'll kickstart with who we are as the Foundation for Cancer Care in West Africa. Foundation for Cancer Care is a registered non-profit organization dedicated to advancing cancer care in West Africa, and our mission is to promote collaborative cancer control and prevention. So, what's our purpose for today's webinar? It's to provide you clear and practical guidance on assessing support in cancer care and also navigating support systems and healthcare pathways. So, that's going to be our purpose for today. And the goals that we intend to achieve during this webinar is to seek support. We want you to know where and how to seek emotional, psychosocial, and financial support for yourself or for your loved one. Then, second would be clear pathways. We want you to understand the exact steps to access support through the organizations represented today. Then lastly, we want you to take action. We want you to leave this webinar feeling empowered with concrete next steps for yourself and for someone you are supporting. So those are our goals for today. So without much hesitation, I would love to introduce our panelists for today. We are having three amazing ladies in our midst from three different organizations, and I would love to introduce them to you one by one. So we have Dr. Precious Gift Bassi in the house today. She's an internal medicine resident, wife, and mother with a strong interest in preventive medicine and holistic wellness. She's committed to empowering individuals with practical evidence-based health information to help make informed decisions and live healthier lives. She's also a passionate advocate for breast cancer prevention and patient support. And she has over 6 years experience in volunteering with Pink Africa Foundation. And she has been raising awareness for early detection, prompt treatment, and supporting patients through breast cancer treatment processes. She is the project manager for Pink Africa Foundation Medical Outreach. Please, a round of applause for Dr. Gift Bassi.
Thank you. Good afternoon, all. Nice to be here.
Our next panelist is Hadiza Neku Amanabo Arume. She is a development program specialist and health systems leader with over 18 years of experience supporting public health and cancer programs across Nigeria. Her expertise spans program design and coordination, strategic communication and advocacy, fundraising, community mobilization, and most importantly, for patient-centered cancer care, patient navigation, and practical access pathways. Adiza currently serves as the operating manager at Medicaid Cancer Foundation and Medicaid Foundation, where she provides technical leadership and operational oversight for programs and partnerships, including fundraising, grant management, program development, communications, and stakeholder engagements. And she has also supported organizational growth initiatives and rollout of patient-focused support programs designed to reduce real-world barriers to care. So please, let's welcome Ms.
You.
Zah to
Thank
the
you
house.
very much for having me.
Sorry, I didn't get that.
I said thank you so much for having me.
Welcome, Ma. You're highly welcome. Thank you. So our third panelist for today is Foundation's own Amanda Yadel Uboji. She's a public health professional and cancer care advocate with experience spanning program implementation and health education, and also community engagement across Nigeria and beyond. She currently serves as the programs officer with the Foundation for Cancer Care in West Africa, where she leads initiatives focused on cancer screening, patient support, public awareness, and strategic partnerships. Amanda also works at the intersection of research and practice with interest in non-communicable diseases, health systems strengthening, and equitable access to care. She has contributed to multi-stakeholder projects, coordinated healthcare training programs, and supported internationally funded initiatives. Amazing work centers on translating evidence into action and ensuring communities are not left behind in the fight against cancer. So let's welcome Ms. Amanda to this webinar.
All right. Hello, everyone. Good afternoon. It's nice to be here. I hope we all have fun this afternoon. Thank you, Shalom.
You're welcome. So go right ahead to our panelist discussion. And we have some questions for our panelists. I'll begin with Ms. Adiza. I would like you to give us the treatment support options that are available through your organization and how patients can access them.
Okay. Good afternoon, everyone. And thank you once again for having me. And thank you, Foundation for Cancer Care, for putting this together. So I will be speaking from the Medicaid Cancer Foundation perspective. Um, our work is centered on one practical mission, which is helping people access cancer care early, stay in care, and even to complete their care. Why? Because in Nigeria, the biggest tragedy, sorry, is not the cancer itself. It's the delay that comes with it. It's the confusion that comes with it. It's the financial burden that stops people halfway. A lot of times, the patients that we see, their cancer cases have metastasized, and so that's the biggest issue, one of the big issues we face, right? So to your question, where you say what treatment options are available through Medicaid. So at Medicaid Cancer Foundation, we think that treatment support is like removing barriers, not just giving information. Our typical um, our typical access programs will fall into 5 different areas, which I will be touching. One would be patient navigation and care coordination. A lot of patients don't actually know what's next step to take after a diagnosis, and so sometimes they come with a scan report, a biopsy report, or even a clinical suspicion, but they are not sure where to go next. They are not sure which specialist is even appropriate for them. They don't know what tests are necessary before treatment, how urgent their situation is, or even how to avoid wasting time and money. And so one of the most important supports we provide is navigation, helping patients to understand their pathway, by clarifying what to do first and ensuring they get to the right point of care as quickly as possible. Two will be referral linkage to credible treatment centers. In our setting, by setting I mean in Nigeria, access is not only about availability, it's about what credibility and coordination. Patients want to know, where can I get treatment that is structured, treatment that is safe, and not even exploitative. So we support these patients by linking them to appropriate center for, it could be oncology consultation, surgery where needed, chemotherapy, radiotherapy where available, and follow-up and survivorship support. Our goal is simple. Our goal is to reduce the trial and error. We've seen this for the past 18 years. The journey that patients go through is always marred with issues of where to access care. Number three, financial support and cost offsetting. This is also based on resources that are available on our end. Financial barrier remains one of the biggest reasons patients abandon treatment. So depending on the funding we have available and the partnership we have with any of the donors, we're able to provide support. And some of these supports may include confirmatory diagnostic investigations. We also do staging investigations. We contribute towards treatment costs such as chemotherapy, surgery deposits, radiotherapy, and essential medicines where feasible. Sometimes emergency supports that prevent treatment interruption, we're able to provide such support as well. I always emphasize that a lot of times this is on need basis as resources allow. This is because we try to be fair and transparent and accountable by prioritizing those with the highest vulnerability and most with urgent need. Number four will be psychosocial and emotional support. Cancer treatment is not just medical, it is deeply emotional as well. So many patients struggle with fear, stigma, depression, and caregiver burnout. I'm sure we're all aware of not my portion syndrome. So Medicaid is able to provide counseling support, reassurance, patient education, what to expect, how to prepare, how to cope, ongoing check-ins that encourage treatment completion, guidance for family members and even caregivers so that patients do not feel isolated. Sometimes just having someone to say, you're not alone and there's a clear plan is the difference between a patient continuing that care and giving up. Number five would be early detection, access, and rapid follow-up. This is a big one, a very big one, I must say, because in cancer care, early detection itself is a form of treatment support because it reduces the intensity and cost of care. So through our outreach programs, we're able to support screening and early detection, structured follow-up for abnormal reports, referral into care pathways immediately so that patients don't disappear after screening. So another aspect of your question that asks, how can patients access support from Medicaid? Patients will typically access our support through four different entry points. One is direct contacts. Patients can reach us through WhatsApp, Instagram, even Twitter, email. Two, referrals. We have referrals from hospitals and clinicians, even nurses. Three, our outreach programs. Patients are identified. Whenever we go to any outreach, any community, we screen them and then we link them up with follow-up for those that are positive. Number four will be partner community referrals. So we do a lot of advocacy and outreaches to faith-based organizations. So even to women groups, even to other NGOs and community leaders, and they all refer patients that they see to us. So when a patient reaches us, we typically will do a brief intake, like diagnosis in Medicaid. We're able to do biopsies, we're able to do pathology in general. And then we also help to document and review their reports, do histology if it's available, if most times it's available, and also to help create a treatment plan with our oncologist and estimate cost where possible. A needs assessment is often done, which entails financial, psychosocial, and logistical barriers. Then we decide the best route or navigation support that will offer the patient. So I'll give you a typical example. A woman gets a biopsy result but doesn't understand it. She's scared and she's being sent from one place to another. So navigation will help her, will support her move from confusion to clarity. Oncology consultations, staging investigations, and care plan instead of wasting months. Another example would be a patient that has started chemotherapy but stops on one or two cycles simply because cost has become overwhelming and the side effects are even frightening. So with our psychosocial support and counseling and even targeted cost of setting where possible, the patient is better positioned to continue and complete their care. So I hope I've been able to touch base on our offerings. Thank you.
Thank you so much, Adiza. You really said a lot and you really broke down the question that was asked. So I'll be trying the same question to Dr. Precious. I just want to know, is it similar in Pink Africa? And if not, can you take us through the um the options that are available in Pink Africa and how patients that come to your organization, how they can access this care?
Thank you so much, Sharon. It's almost similar in East Africa. We organize outreaches, medical outreaches, where we do, I think our main aim is early detection, because we all know early detection increases the chances of cure. Okay. So we organize outreaches where we carry out breast examination and ultrasound scan for any of the women who comes around with a lump. We do ultrasound scan, and then from there we refer them. We partner with the teaching hospital here in Calabar, University of Calabar Teaching Hospital. So there is a clear path of a referral path from this outreach, this medical screening exercise, to the teaching hospital where the necessary biopsy is done and any other investigation necessary. And then if the lesion if the lump is malignant, the lady is now referred to the surgical department where the follow-up care is done. If surgery needs to be done, Think Africa Foundation sponsors the breast mastectomy for women who are picked up during our outreaches, and then we help them support their surgery, and then also refer them to we have a good radiotherapy center here in Calabar, the Still Diagnostic Center. So we refer them there for radiotherapy and then further management. And then, like she said, also we also assist them during treatment and post-treatment, individual and family support. Try to follow them up. We have the support group, the Pink Empress Foundation, which is the subsidiary of the Pink Africa Foundation. So Pink Empress comprises of breast cancer survivors and women at different stages of treatment. So the main aim of the Pink Empress is to support and give hope to women who are recently diagnosed of breast cancer. When they see other people who have gone through treatments and who have survived, it's source of encouragement and a source of hope, to these women. So we carry out counseling sessions with Pink Empress. We visit survivors, get their stories. The women who are undergoing treatment have the chance to ask questions, get clarification wherever there's any confusion. Then they also get advice on nutritional support, because during chemotherapy, it's a very tedious and very difficult period in the life of the patients, and they need all the support they can get, especially also nutritional support. So we have survivors on who help to, counsel them, tell them their stories, answer questions, support them. It's like just a support system for any woman who is battling this breast cancer. And then we also give palliative care, for post surgery. We give them post mastectomy bras to help them with their self image. We also give wigs to women who are undergoing chemotherapy to help to encourage them and to let them know that this is just a phase in their life and to pass with the right supports and with the right treatment. We also educate them on the necessary treatment modalities. And then um, for the how we can be reached, we have a website. We have our website, Think Africa Foundation, so people can apply through Think Africa Foundation. Our emails are also active, and then during the outreaches, we also get people in need of support during our outreaches. And then our social media handles on YouTube, Instagram, and Facebook. We are quite active on social media, so we get a lot of requests for sponsorship from these platforms. Thank you.
Thank you so much, Dr. Precious. Thank you so much. That was beautiful. And I could see the differences from the two organizations. Even if there are some similarities, there are still like a little bit of differences here and there. So I would love to throw the same question to Ms. Amanda. I want to know if these options from Medicaid and Pink Africa are also being used in the Foundation for Cancer Care. So, what are the treatment support options available in Foundation for Cancer Care, and how do patients that come into that contact the foundation, how do they access it? Thank you.
All right, thank you very much, Shalom, and thank you very much, Hadiza and Dr. Precious, for your contributions. And it's amazing to see the work that your organizations do at both Medicaid Cancer Foundation as well as Pink Africa Foundation. And just to tease you, Shalom, you already know what we do at the Foundation for Cancer Care. So I believe this question will be more beneficial for our, audience. So, sort of similar to what, Hadiza and Dr. Precious rather have said, cancer care can be burdensome in the country, particularly here in Nigeria. And when you look at the different states, I know that each of our organizations are in different parts of the country, but we can see that the challenge faced is similar wherever you are in Nigeria. And to cater for this gap that has been noticed, what we do at the foundation is, I would put it in steps. So I would not start from the treatment option part. I would start from, a general overview of what we do and take you down to the treatment options available. So as Shalom introduced us earlier, we're a non-for-profit. However, we have our sister organization, which is Lakeshore Cancer Center, that caters for everything clinical. And, we have that on the side. And at the foundation, as Hadiza mentioned, early detection is key in ensuring that people have their proper treatment pathways. And to fill in that gap at the foundation, we have our community screening programs where we cater for breast cancer screenings, cervical cancer screenings, and prostate cancer screenings. And we take them to the community and we ensure that these women or men are able to get the screening and also the educative information that they need regarding these various kinds of cancer. And we don't just leave them to dry by just screening. It's a process. When they get screened, we follow them up to the diagnostic stage where they might need could it be ultrasound, they might need biopsies, and whatever treatments they need as they progress, depending on funding available, we ensure that we make that available for them. And in the case where funding is not available, we ensure proper referral to organizations, partner organizations and hospitals where they can get this at a very subsidized, rate. And then this brings me down to the treatment options available. So at the Foundation for Cancer Care, we primarily focus on radiotherapy support for our patients. And in that, how basically the process goes is you send in certain documentations. We have a committee that reviews that to ensure that your treatment plan is as it should be. And, if it deviates from the usual, certain things are recommended for, your doctor or your, oncologist, whoever has you referred to us. And you are then, triaged in a way. And once you meet the criterias, you are then funded for this treatment. And our funding limit per patient is 1 million naira, because we have seen that radiotherapy is one of the most expensive, forms of cancer treatments in the country. And it's one of the treatments that is very difficult for people to get the money lump sum at a time. So we have decided to focus on that and ensure that patients who cannot typically afford have access to that. And in doing so, since inception in 2021, we have been able to successfully fund over 30 patients with radiotherapy support of different kinds. We have patients who have breast cancer, cervical cancer, head and neck cancers, and we've been able to support them. And in terms of, you might then ask, what is our criteria? What makes me eligible to be funded by the Foundation for Cancer Care's radiotherapy funding scheme? And I would say one thing that is very important, in as much as we are Foundation for Cancer Care in West Africa, we're trying to start from home. So you have to be a citizen of Nigeria. It doesn't matter your tribe, your religion. You are not bounded by the space of, being based in Lagos. Wherever you are in the country, you are eligible to be funded by the Foundation for Cancer Care. And outside of that, you'll be required to have, certain medical documentations available, such as your medical reports, some CT scans, and as well as other test reports that you would need to be reviewed so that you can get the funding available to you. So outside of that, we have our psychotherapy support program, and that's one of our new initiatives, and it's catered for patients who we have seen that require psychological support, emotional support, because outside of the financial burden that cancer has on its patients, we also know that it has the emotional burden, not only just for the patients themselves, but also for the caregivers. However, at the foundation, we're solely focused with patients. So we have from time to time, oncologists or doctors of these patients refer them to us for that sort of support. And we have a partner organization that ensures that their needs are being catered to in terms of, counseling and, therapy from, wherever they might be in the course of their treatment progress. Either they have just been diagnosed or they're currently going through, the treatment plan. So we have that support available, and it's also, funded and in partnership with our partner organization. So basically, those are, I would say, the major treatment support options we have at the Foundation for Cancer Care. And outside of those things I have mentioned, we have a support group known as Dewdrop Support Group. It's the support group for Lakeshore Cancer Center. However, the Foundation for Cancer Care manages the Dewdrop Support Group. It's a vibrant support group that has, everyone, men, women, the young, the old, at different stages of their cancer journey. And what makes it a beautiful place for patients to be in is the fact that, as I said, it's on a spectrum. We have everyone from, be just being diagnosed to remission. So we have them encourage each other and provide, that peer-to-peer support that's needed. So how you can benefit from that, basically, we are available on social media. We have our Instagram, Facebook, we have LinkedIn. You can always send us a DM. And we would also have our email address ready for you in the chat box, our email address as well as our phone number ready for you in the chat box. You can always send us an inquiry for whatever, treatment you might need, from, the diagnostic stage up onto the treatment part. Even if we don't provide those for you immediately, we will be able to triage you and refer you to facilities who will be able to support you, adequately in that. So thank you very much.
Thank you very much, Amanda. Thank you so much for that. So, course of time, for the following, the many questions that we have available, we would love for our panelists to just keep it to 2 minutes for the remaining questions so we can meet up with the time that we have left. So, our next question will be for the Foundation for Cancer Care's representative, Amanda. I would like to know what the most frequent treatment related requests you get from patients that come to you. So just 2 minutes, just even less if possible.
Okay, so I'll just hit the nail on the head. So we have an array from radiotherapy to chemotherapy. We have patients who request for support in terms of scans, CT scans, MRIs, and little diagnostic tests like biopsies, immunohistochemistries, and other accompanying tests. So it's not just limited to the treatment itself per se, but we have from the diagnostic end to treatment. So we have a couple of options, or rather inquiries, that we get at the foundation regularly. Last year we had over 50 inquiries for different supports needed, and we're successfully able to refer to organizations where they would benefit from that. So we get a couple of inquiries during the year. Thank you.
Thank you very much, Amanda. So, Ms. Adiza, can I also know the frequent requests you get from patients in your organization?
Okay, this question is very important because it shows where the system is failing patients most often, right? Um, Patients will ask, "Oh, I have a diagnosis. What do I do next?" This is probably one of the most common questions you get if I ask other panelists as well, right? Patients usually don't know the pathway, and a lot of times they are overwhelmed and they need a clear roadmap. Another question would be, "I can't afford the treatment." Or another, sentence from them would be, "I can't afford the treatment." This is constant, Sha, and permits me, I'm just overwhelmed myself with all the numerous questions, and not being able to provide 100% care is really, really heart wrenching. So, requests would usually come in form of, "Oh, we need radiotherapy, I need chemotherapy, I need surgery, I need money for surgery, imaging, they've asked me to do an echocardiography, I don't have money for it, I need to do lab, I need to do my tumor markers test, I don't have money." And then even for, pain relief, as things as like morphine, they need money for it. So those are the kind of frequent questions we get. We also get things like, how can I access trusted treatment? Very key, because you know what healthcare truly means in Nigeria. They ask us those kind of questions, and then we're able to advise them. Then another question that is even more heartbreaking would be, "I'm struggling with side effects. I have fear. When will this stop?" How can we answer this kind of questions? Another one is stigma. They ask, how do I tell my friends? How do I tell my families? Patients often suffer rejection. They suffer shame. They suffer that they suffer being treated differently. Nobody wants to be treated differently, right? So again, caregivers, they become really exhausted. This is where psychosocial support really matters, not just for the patient, but for their families as well. Then patients will often ask for transport and logistics to get to where they can get treatment. So those are the kind of frequent questions we'll get. Thank you.
Thank you so much, Adiza. Thank you for that. So before Dr. Precious answers the same question, please, if we have any question, you can drop it on the chat box. Just drop your questions on the chat box. They'll be answered after the panelists are done with their session. Thank you very much. So for Dr. Precious, can you just briefly tell us what the requests your patients give to you in your organization?
Okay, thank you, Shalom. My other panelists have said most of it. Requests for financial support for surgery, radiotherapy is the bulk of it, that's like the most expensive part of the whole treatment. So most times we support patients for the surgery, take the cost of surgery and hospital admission. But after surgery, they need money for chemotherapy, they need money for radiotherapy, and then they need money for nutritional support. So they don't even know what to eat, side effects of chemotherapy, the weight loss, the weakness, the nausea and vomiting. So they keep asking, what do I eat? What do I not eat? How do I gain back my strength? How do I be with my blood level? Because most patients undergoing chemotherapy, there's a routine full blood count test done before each session of chemotherapy. And then sometimes we might need transfusion, and that's another cost on its own. In fact, last year during our yearly Think Africa October Theme Day, we had to even create an opportunity where people came to donate, blood for voluntary donation for cancer patients in Teaching Hospital, University of Calabar Teaching Hospital. So they asked, what do I eat to boost my blood level? Then also people who have to travel from the distant localities to the teaching hospital here for treatment, they don't have where to stay, especially their caregivers. After each session of chemotherapy, traveling back to their locality and coming back again after 3 weeks for the next session or 1 month for the next session. So the support for accommodation, transportation, okay, and then what to do about the side effects. What do I do? How do I help this vomiting? The side effects of lymphedema when after surgery they have the one limb, maybe the affected side gets swollen because of lymph removal of the lymph nodes on that side. You keep asking, how do I get my hand back? And then also there's also the request for sometimes we need physiotherapy because after the surgery, like those who undergo mastectomy, sometimes they have this contraction of the skin around that site. It gets kind of strong and they have difficulties moving the hands and all of that. So these are the questions mostly during the treatment, after the treatment, how to cope, how to, go back to work. Those who were working, how do I go back to work? How do I carry myself outside this? That's why the support the support system is very important for these people, for these women, so that they can go back into society especially after their treatment, go back into society without feeling, left out or without feeling like they are handicapped or something. So then also one other very peculiar question especially for the women undergoing chemotherapy for breast cancer, is the fertility aspect, especially for the younger women. Would I be able to conceive later? Would I be able to mother a child later? What's the effect of this drug on my fertility? I know some bigger centers that actually outside the country, they have the option of, storing their eggs and all of that. We don't have those options here. So the younger patients are concerned about fertility. What does this imply for me after? What's my would I be able to have children later? So these are some of the many questions the patients ask here.
Thank you so much, Dr. Precious. Thank you so much. So we're moving along, we're going into our support system, and we have some questions for our panelists. I'd love to throw this question to Dr. Precious since she's spotlighted right now. So just quickly hit the nail on the head. What does a strong support system look like for someone who is currently undergoing cancer treatment? And who do you think should ideally be a part of the entire care process?
Okay, thank you for that. The support system is it's key in the whole treatment process. Aside the financial aspect, the whole emotional burden of the diagnosis of cancer, it's huge on an individual and the family. So a strong support system goes a long way to help in recovery in these patients. When there's a will, there's a way. If the patient has the will to live, feels that love and support around her, she has a higher chance of fighting through it all and getting better. So the support system is to be made up of people who are, passionate, who are consistent in their care, and who are, passionate about the well-being of the person. Okay, so for the members of this support system, I would say it starts with the medical team. Okay, if we have a medical team who they're not just treating, which I'm talking to like for a medical, I'm a medical doctor myself, so the medical team not just treating these patients as just mere cases, but giving them that listening ear, being able to listen to their side effects, being able to empathize with them, offer solutions to the problems that come up day in and day out, being available to give advice, especially nutritional advice, advice on physical fitness and what to do to keep them through the treatment process. So that the medical team is the first, important parts of the support system of these patients. And then you have the oncology team, the surgeons, the radiotherapists, the oncology nurses, and then even the pharmacists who provide chemotherapeutic agents for these patients. And then you have the family and caregivers. That's the next part of the support system, the family. So it's important, we like in Think Africa, we try to involve the family. When the forms are filled, we have some forms the patients fill where we get to know if they are married, the number of children, and all of that. So the family is very important in the support system of these patients to assist in daily needs, especially when they are going through chemotherapy, when they are weak, they can't spend for themselves. We need that love of the family to come around them and to help them take care of their daily needs, get medications, feeding, emotional assurance, and all of that. Then also, counselors, counselors are very important. People who, like, I'm glad to hear your foundation. Um, Amanda mentioned the psychotherapy part of the foundation, and I'm really glad. So it's very important. That's emotional support counselors who are trained to talk to these women, to talk to these cancer patients, and to encourage them and at every step of their treatment journey. And then even spiritual supports, those, for the Christians, the church, to support them spiritually or whatever religion, So that spiritual support is very important also. So it's a holistic thing. It's a holistic thing beyond the medical team, family, the community, you know, it's a holistic thing. So they need all the support they can get during their treatment process.
Thank you so much. Thank you so much, Dr. Precious. Miss Adiza, yeah. So I'd love you to also answer the same question. What psychosocial support services are available in your organization, and how do families and patients access these options?
Okay, so um, there are four practical pathways through which a patient can actually access psychosocial support, which aligns with what Medicaid Cancer Foundation does. So it could be through a hospital. We can ask, an oncologist about counseling to include it in their consultations with the patients, and not just, you see, it's one thing for you to refer a patient, it's another thing for you to also be there to follow up. In our own case, what we usually do we send a patient to this particular doctor we are familiar with, and we're like, okay, please, these are her fears, these are her worries, we need you to allay them, we need you to guide her, we need you to be patient with her. Not every patient will get that, but those are the things we do, or those are the things we do. Also, we do things like, provide palliative care. We have a program called the Orange Box, where we would buy things that a patient would need through chemotherapy, for instance, to help sort their side effects. And we would also organize counseling. I've had patients who said, oh, I watched a crusade online, and the pastor prayed for me, and I know I'm healed. We don't usually discredit that, but we would support them and say, look, religion and treatment can be complementary, right? So you can't take one out and leave one out. So we'll organize a counseling session for them, either with a survivor or with a counselor. So a counselor can come from, a religious aspect and help to encourage them to continue their treatment. And a survivor will also come and say, oh, I've passed through this treatment journey. You too can do it. This were my side effects, and you can pass through. So I don't want to repeat the same thing Dr. Precious has already said, but it's very similar. So I just needed to pick out some unique things we do from our side. Thank you.
Thank you so much, Miss Adiza. Thank you. That was on point. So I would love to ask Amanda the two questions that I asked Dr. Precious and Miss Adiza. So she just gives us an answer like at once, so we don't waste too much time. Okay, so I'll try to shorten it and make it as succinct as possible. So, Amanda, in the Foundation for Cancer Care, what strong support systems are available for someone undergoing cancer treatment? And how would one ideally be part of it? And also, what psychosocial support services are available, and how do patients and families access this care?
Okay, thank you very much, Shalom. I believe Hadiza and Dr. Precious have really done justice to all those questions. Dr. Precious mentioned the importance of holistic care from, the clinical team, having counseling involved, and the caregivers being, the family. And we have other little elements such as psychotherapy and, physiotherapy rather, for those who typically need that. So I believe that question has been really addressed, so I wouldn't touch so much on that. And in terms of what the foundation does for support, psychological support, I mentioned earlier we have a psychotherapy support program where we have counseling sessions for patients who are in need of it. Patients who come to us telling us they need counseling, emotional support, or patients who have been referred by their doctors. So, we have two routes. You either come yourself or your doctor refers you, to us. So we have that available. Then outside of that, I know both Hadiza and Precious touched on the fact that people need support in terms of, nutrition and basic little things that should be made available for their treatment plan. But this is solely dependent on funding, where we have support for patients in terms of, their nutritional needs to support their treatment progress and, little things they might need for their treatment as they go, as little as maybe people that have to go to general hospitals and require buying gloves and those little things. We try to cater for that, but as I mentioned, that is solely dependent on funding. So basically that's the sum of it all. So over to you, Shalom.
Okay, thank you so much, Amanda. So we've come to the close of our panelist discussion, and we'd love to introduce Zainab Adigbite. She's the research coordinator in Lakeshore Cancer Center, and I just want her to give a summary. Next 2 to 5 minutes, I just want her to give a summary for the cost film study that is presently going in the Lakeshore Cancer Center.
Good evening, everybody. My name is Zainab.
Hi, Zainab. Can you hear me?
Maybe you can hear me.
Okay.
Okay.
Yeah, I can hear you.
All right.
Please go ahead.
Okay. Good evening, everybody. My name is Zainab. I'm the research coordinator at Lakeshore Cancer Center. I'll just be speaking briefly about our costing study. And as everybody has been saying about cost first. So in Nigeria, most of the patients they pay out of pocket, and insurance coverage in cancer care is very, very minimal. And many patients delay treatment. Some even abandon treatment completely. So I want us to think about your own clinical experience. Have you ever seen patients postpone chemotherapy, skip radiotherapy, or disappear after diagnosis? You can answer that question as well. So what is financial toxicity? So financial toxicity is the financial burden of cancer care when it becomes harmful to the patient's health. It affects the adherence, mental health, and survival. So why did we want to do this costing study? So it is a health system intervention. We introduce something called financial navigation. Instead of giving patients treatment, use, and plan, we assess their financial situation. We create a financial plan, link them with insurance, HMOs, charities, and foundations, coach them and follow them throughout their treatment. Think of it like a social worker plus a financial advisor, specifically for cancer care. So this approach has worked in the US, but has never been tested in sub-Saharan Africa before. So this study is a randomized control trial. At the moment, we've screened 693 patients. 221 patients have been enrolled. 102 patients have been randomized. So we then follow patients for 1 year. What are we measuring? We are trying to understand the financial catastrophe, the financial distress, the cost-related non-adherence. Also, we also want to take the quality of life, the mortality, the patient satisfaction. This is important because we are just not asking to be helpful. We are trying to also measure to improve patient outcome. So in Nigeria, many cancer deaths are not biological, some are economical. Patients sell property, withdraw children from school, stop treatment halfway. Financial barrier causes delay, and delay in cancer equals to mortality. So if the financial navigation works, it changes something fundamental. We can move from can you afford treatment to how do we help you stay in treatment. So far, in this study, patients are actively engaging in financial resources. Multiple patients identify high financial needs. Navigation is feasible in our settings, and if proven, this is going to scale up to other types of cancer, chronic disease, national programs. At the moment, this study is currently ongoing on in Lakeshore Cancer Center, OAUCAC in Leyte, and also MedSevLoop. So we are supported by TaylorMade and AGO. So this is not just about publishing paper. It's aligned to Nigeria National Cancer Control Plan, Universal Health Coverage Goals, and Sustainable Financial Goals. So, hello.
Yeah, Zainab, we can hear you. Go ahead,
Okay,
please.
thank you. Thank you very much. So, in conclusion, I will leave you with this. If financial toxicity is predictable, should financial navigation be standard of care? Thank you very much.
Thank you so much, Zainab. Thank you for giving us a summary of the cost fin projects happening in Lakeshore. Thank you so much. So without much delay, I'd love us to go into the Q&A section. I have my colleague here with me. Chioma should be helping us take the questions, and any of our panelists can just answer, give it a go and answer. Thank you.
Hi, everyone, and good afternoon. Thank you once again, our panelists. I learned a lot, and I hope that everyone who joined in here to also learn as much as I have. Quickly, we have like some questions here that just, I think we have like one or two questions where some people just want to get some clarifications on something. And I know that at the beginning of this session, we spoke about the how expensive cancer treatment is and how to assess the scale. But somebody in the comment section still wants clarification on why is it so expensive? What are the things that have costs? What are the things that has happened that have brought about the increase in price to cancer treatments in Nigeria? And I'll just throw it open to any of our panelists to answer the question.
Okay. I think I'm back in. Can we hear me?
Yes, we can hear you.
All right. Thank you very much, Chioma, for that. So, basically, in my own opinion, and being on the field, like the work we do, I would say that cancer care is expensive due to a couple of factors, and I would summarize them into two. One, we have, the issue of access. So, access in terms of the medical devices itself that should be used for, treatment. Most of this is imported into the country. So when you look at the duty importation cost and importation cost of the drugs that we have to um, patients need, basically, you see that that also has a way of increasing the price itself. Then secondly, we have the issue of health insurance. In Nigeria, most of our healthcare is out of pocket. Many people do not have access to health insurance, and many health insurance plans do not cover cancer care, cancer treatment plans. So that has a way of, trickling into the cost and making it more expensive. Then lastly, I would say that because in Nigeria we have more cases of late presentation, so there's late diagnosis most times, and when patients present at that point, treatment costs are usually at the highest point. Many of the things that need to be done require, more care and more, holistic treatment as opposed to if caught earlier. So the treatment plans are longer, the care you need from your medical team is more than what it would have been if, diagnosed earlier. So those are the situations or the issues that I would say makes cancer care quite expensive in the country. Over to you, Hadiza. I see you have your hand raised.
Okay, I want to add that things that make cancer care expensive in Nigeria, just to add to what Amanda has said, radiotherapy is quite scarce and very costly to run. So there are just very few functional centers in Nigeria, and they require constant maintenance, specialized staffing, parts replacement. I mean, we run MRI here, CT scan. I know what it means to maintain that equipment every year. So those are the things that drive up cost, and patients have to spend this money. Again, she mentioned lack of insurance, out of pocket, very important. And also, I want to add that there are some hidden costs that patients don't see, things they don't plan for, like transport, feeding, time off work, caregiver expenses, and even accommodation near treatment centers. You can imagine in the whole of northern Nigeria, you have maybe who don't working today, not working tomorrow. National Hospital breaks down today until another 2, 3 weeks. Patients have to travel all the way to Lagos. They probably don't have any family member in Lagos to, stay with. So they have to pay for accommodation. They have to pay for feeding. So there's nothing little in the cancer treatment journey, right? So those are the things that cause cancer care. And I'm not sure if she mentioned imported drugs. All cancer drugs are imported, right? And because of foreign exchange, if the naira weakens, the prices go higher. So those are the things that would drive the cost crazy. Thank you.
Thank you so much, Hadiza, and thank you so much, Amanda, for that insightful response. So, a lot of factors play into why cancer treatment are very expensive. Um, so, the other person here just asked that how can she get like treatment support? She would appreciate like support that she's going into her fifth cycle of chemo in 2 weeks. And I know that when Amanda was speaking, she spoke about like communities that we have here at Foundation for Cancer Care, D Drugs, and she has just dropped the form there. So you might just want to look at that quickly. And then the last question that we have here, so Assistant again is still asking, for people who run to have herbal sellers to treat cancer, what would be your final like advice to them, or what would you say to them, just where you have to look at alternative medicine as an option in the treatment of cancer? Yeah.
So I mean, we've seen patients who. Can I take the answer? Sorry.
Please go ahead. Please go ahead.
Okay. So patients run to herbal sellers for cancer treatment for plenty reasons. It comes from fear. It comes from cost. It comes from culture, and even the access gaps we've been talking about since. This is not because people are foolish, they're not. Besides, Nigeria was more of a traditional, country before the introduction of various religions. So I would say people do it for cost and poverty. People do it because of late presentation and, of course, desperation, fear of chemo. I have so many patients that will come in and say, "Oh, people say I shouldn't do chemo, that it will kill me faster." Their trust and familiarity also plays a role. People who believe in traditional healers, and maybe because the person speaks their local language, right? And again, they are easily accessible than the hospitals. Treatment is only at the tertiary level. Even the primary care is not even there, let alone the big hospitals. Then bad experiences with the health system. We have so many issues when it comes to our healthcare system. And so if there is delay, if there is poor communication, harsh attitude from the medical staff to the patient, they push patients away and they run. And then misinformation and fake testimonies. I see people say things like, "I was cured." You see stories online on Instagram every day. Hey, those are the things that would make people run to herbalists. Thank you.
Thank you so much, Hadiza, for that response. Like I said, a lot of factors make people to get looking at alternative source of medicine for the cure of cancer. I do hope that we have learned a lot, and I am very happy that I was also part of this session because I have learned more than enough. And I think that every day, like in this journey for cancer treatment and all, there are new things that actually come out. And here today, I honestly I did learn. I'll just be handing over again back to Charlotte to close out the session. Thank you, everybody.
Thank you so much, Chama. Sorry about that. Thank you so much, Chama. So, in conclusion, I would just love to thank our panelists for educating us on the various questions that were discussed today and are available in their respective organizations. From what I've gathered from today's session, I see that each organization is very big on psychosocial support for patients and caregivers, and most importantly, financial support and cost offsetting. So I would love for each organization to just drop their social media handles and their contact info so people that join the sessions they would be able to take note of it, and if they need any help whatsoever they can contact you. So I'd just love for us to do
Please,
that quickly. Okay.
sorry,
Yeah,
not
please go ahead.
to cut you short, but I would like
Yeah.
to do a closing remark from Medicaid perspective, right? I want to sincerely thank Foundation for Cancer Care. Thank you immensely for your support. You guys, your commitment to providing our patients with free radiotherapy anywhere in Nigeria at no cost has been really, really, as in truly inspiring. Thank you so much. These are the kind of partnerships that Medicaid truly values because they remove the biggest barrier, right, in cancer care and access. Thank you so much. Thank you for standing
Thank
with our
you.
patients. Thank you for enabling us through real practical support. Thank you. My colleague Shino is on this call. He's always on the call with Amanda. Amanda, we have a patient. Amanda, we have a patient. And all she does is give me the forms, give me out. She fills it, and then she tells us, all right, where is this patient going to? We say National Hospital. Give us the account number, they pay. Thank you for making that process seamless. We're truly grateful. Thank you.
Okay. Thank you so much, Adiza. Thank you. That was really lovely. Kudos to Foundation for Cancer Care for the work they do. So we'll be closing the session now. Thank you, everyone. If you have further questions, please contact each organization and you can drop your questions on their contact info. And these are our social media handles on Twitter, Instagram, Facebook, LinkedIn, and YouTube. We are at Foundation for Cancer Care. And this session is actually recorded, so you can watch the recap on YouTube afterwards. So if you have any question, you can message us. You can email us at info@foundationforcancercare.org. And if you have any question that you would love to drop on our WhatsApp, the number is there 070-2500-7752. Thank you, everyone, for coming in today. Have a
Thank you
wonderful
very
week.
much. Thank you for having me. Thank you,
Thank you,
everyone.
Thank you for
everyone.
having us. Thank you. Bye.
Okay.